Thank the gentleman. Let me recognize the gentleman from Ohio, Dr. Wenstrup, to inquire.
Well, thank you very much, Mr. Chairman. Mr. Secretary, thank you for being here. Let me just, in light of the recent conversation, one, in the bill that we passed in the House of Representatives, we were giving states the opportunity for a waiver if they had a high-risk or pre-existing condition program that actually functioned better than the federal program. That was the purpose of that. But also, let me go again to the budget. Medicare gets another President's budget. Medicare gets another 25 years of life under this budget, and Medicaid grows year over year. Let me point out that there's more than one body in this government that we have. And budgets aren't law, they're a template. And you can rant all you want, but I find it interesting to complain about the President's budget when there is no House budget. Present your House budget, and that's what drives the conversation. So I would be hesitant to be too critical of the President's budget if you don't have one yourself to make the recommendations. It's easy to criticize, but it's better if you have your own solutions. Mr. Secretary, I'm glad to see you here and that you're going to focus on rural health care. That's very important to me. As you are probably aware, we have a nice bipartisan task force with Representatives Sewell, Davis, Arrington, and me. We want to address workforce shortages, reimbursement and payment schedules, to have some flexibility, especially for rural areas, digital and telehealth, and what we've come to call the social determinants of health, which I know are valuable and important to you, that we address those issues. Another focus that I have in particular, too, is on graduate medical education. We can talk about health care all we want. If we're not graduating enough physicians and we don't have residency programs for them, none of this really makes much difference, does it? So I think that that's one of the things that I would like to work with the administration on, along with these priorities for rural health, which I know are priorities of yours. And, you know, we can do better. Residency programs in rural areas, a lot of times people stay where they train. That's very common in medicine, as we both know. So how can the task force here on Ways and Means coordinate efforts with HHS to really serve our rural communities better?
So we'd love to work together on improving rural health. One of the ideas you just mentioned around graduate medical education is in the budget, which would merge Medicare, Medicaid, and children's graduate medical education, take it off the books for Medicare, put it on general tax revenue, which is where it should be, and allow flexibility so we get out of the structures that were frozen in place in the 90s and allow people to have GME in rural America, have primary care, psychiatrists, to have that flexibility to meet our underserved needs right now.
Yeah, I agree with you, and it's not just rural. We have urban underserved areas that would benefit from the same type of approach. My district is Southern Ohio, as you're well aware. That's ground zero for our drug problem. It's not just opioids, heroin, et cetera, meth, on and on. Can you tell me about the additional flexibility in the President's budget that would allow us to use tools at our disposal, especially locally, to fight the broader substance abuse epidemic?
Absolutely. So actually, I was delighted last year when Congress added to the State Opioid Response Grant Program the ability for states to use money for methamphetamine and other stimulants, because in states, and I know I've spoken with the governor in Ohio, in some states, methamphetamine is becoming more of an issue than even opioids. In some states, it's always been. We've got 15 of the 36 states that report overdose deaths by drug type. Meth use was responsible for more deaths than synthetic opioids like fentanyl. So that flexibility is critical for our states.
Well, thank you. My time is up, but I look forward to working with you and your team and with my colleagues from across the aisle.
Thank the gentleman. Let me recognize the gentlelady from Alabama, Ms. Sewell, to inquire.
Thank you, Mr. Chairman. Mr. Secretary, in my